So my name's Gord Garner. Welcome to Conversations of Substance. It's really my pleasure today to welcome Agnes Chen from Calgary, from the Starlings Foundation. And she's here to tell us about the great work that she's doing and how we might be able to work together, and a little bit about the struggle of being a nurse. So hi, welcome to the show, Agnes.
Thank you, Gord, so much for bringing me here and for having this conversation.
I think it's really important. So let's start with Starlings. Where did that come from? What is that going to do for people?
Yes, thank you. So Starlings was really inspired probably about 10 years ago. Initially, I wanted to create an anonymous blog, very anonymous, for children impacted by a parent's substance use. And it was going to be anonymous, and I had everything written out and how I was going to approach it, and then I didn't have the guts to hit send. So then about 3 years ago, I was chatting with my husband. I said, I'm just going to start Starlings community with the intention of bringing more understanding of the situations that can bring people to a place such as substance use and addictions, poverty, homelessness, domestic violence, all those things that are so interwoven. But how can I, empower people with knowledge to just see a human first? And so that's really where the take that I wanted to have. How can we create a narrative that says, hey, look at the people first? And it has been really, really great. However, about a year and a half ago, what I realized was those messages are beautiful and they're so important, and we need to talk about empathy and compassion and having more empathy and compassion. But as somebody myself who grew up in a home where unhealed trauma and substance use, problematic substance use existed, the conversation that was missing was, yes, people need more empathy and compassion, but we forget that what unhealed trauma can do to a person's emotions and behaviors. And how easy is it for someone to show empathy and compassion to somebody in that moment? And so the conversation became always where my heart was for this, is how do we better support children impacted by the stigma of a parent's substance use? And so Starlings community was born as it exists today. And that theme of empathy and compassion is still at the root of it, but it is more focused in talking about how does stigma remove someone's ability to provide empathy and compassion? How does stigma remove empathy and compassion within policies? How does stigma impact the empathy and compassion the whole community can provide a family? And so that's where we're today.
So none wonder I was excited to have you come and visit. These are things that touch deeply both into my heart and my mind, right? We're talking leverage point. We're talking that compassion is a skill, right? That empathy is a learning, right? That there are skills we may not have, and there's skills that we might have that we lose. So when you talk about the impact of children, I've got my pink shirt on today because I was thinking about our conversation earlier, and we talked about this before the show, that in some ways this is bullying that's taking place, but on a much larger, deeper scale. This is not just the schoolyard. This is the nurse that came to the house. This is the police officer that came to the house, the social worker that came to the house. Can you touch on that for me, and just what are these impacts, and how do they get created?
Absolutely. So, when you asked how was Starlings created, the seed that was planted in me, and it does come from this, social justice lens of, I felt as a child, and I'll share this maybe as just an introduction to that sense of bullying. The first time that I experienced, and I remember feeling stigma, and the impact it was when first responders came to our home. And I would have been, and I can't remember the date because our brain works in funny ways. So maybe I was 5 or 6, but I was little, really, really little. My third is that age. And first responders came to our house after an issue that did involve substance use in the home. But we just wanted help, and help for our parents who we loved. We were waiting for that, for parents who we knew had so much good in them but struggled. And I witnessed aggression as a 5-year-old at the top of our stairs, sitting, waiting for this help to arrive. And I remember, right, we often define stigma when we talk about it. We know what it is. It's discrimination, it's labeling, it's judging, it's marginalizing, oppressive, right? We know the definition, but we often forget to talk about what it feels like. And that feeling of stigma within a person is so devastating. And that I still today, like I can feel that. I can feel that shame, that fear, that anger, that sense of hopelessness. Like we reached out for help, and the help provided something very different. And you recognize very early why that sense of secrecy starts, because we reached out, we did reach out. We tell kids reach out.
Yes.
Right, but when it comes to addictions, it's very different. And substance use, it's very different when you say reach out, because we don't want you to penalize or criminalize our parent. We want help. We want you to see their good. Yes. When we see something different and you treat different, then that gets hidden away. And so that idea of bullying, they didn't stigmatize me. They didn't look at me and stigmatize me. But my sense of being, all of who I am, exists within a bigger world, within my family. And how I saw how my parents were treated directly impacted the way I was going to be able to develop and grow and what I thought of myself. And of course, if that was the only time in my life, maybe it would have been very different. But I was a teenager and I had first responders ask me, well, why are they drinking on a Wednesday? And that, again, that sense of shame.
Yes. Right?
I had, again, as you know, in high school, and these are very vivid memories I have of a family member who was in distress, medical distress, and hearing first responders yell at them because they were intoxicated. What does that do to a developing child and a teenager in that moment? What does that tell them about themselves? Yes. Right? And we learn, don't reach out unless you're in a crisis, and then that crisis is there. And in that moment, I didn't have, the voice to say this is wrong, right? Because it's one child against like the world, and criticizing health professionals and police officers who have such an important role, and who put their own lives at risk and their own mental health at risk to support people. It's very challenging. But that just speaks to, the discrimination that happens on such a deep level and how it's so deeply rooted, and why these conversations are so important, to recognize how our actions can either enable a family's healing or prevent it and sideswipe it. And
and real stuff, right? And that moment of, seeing that again or feeling that again, right, was very apparent to me. Brought back memories of my witnessing other things. And I think so this conversation, right, to be able to have this talk, right, that we'll say this is true, right? Mm-hmm. I don't think that a lot of people in Canada understand that helpline, the one they think is great and they know they can rely on, is the one we can't use. The one that brought extra harm into our lives. Right? Because we thought we were like the others and we thought we could use that line too.
Absolutely. Absolutely. And I think that's, that stigma is really hard. And I've been told, anti-stigma isn't, it's not a political ask. You can't ask for people to reduce stigma. You can't ask. And it's very complicated because I don't think anybody sets out to stigmatize. As a nurse, when I'm going to see a patient, even as a nurse with my experiences, stigma is so ingrained in us and our perceptions of people, because we all have our own experiences, right? If I've had one bad experience with a police officer, I'm gonna have that feeling in me. And so, but it's how do we unravel and dig deep and have these hard and courageous conversations, even within professions that can perpetuate that stigma and do harm because of those deep beliefs.
A wonderful, interesting conversation with some emergency room staff who said to us, well, we never talk about those people in front of them. We do it in the lunchroom. The idea that there's none of their colleagues have the same issues as some of their patients, right? And that there's some place I can talk about this where the others aren't. So that othering aspect. And of course, we say stigma is the result of deeply held set of false beliefs that allows the oppression and discrimination against people either overtly or in silent compliance. So that deeply held set of false beliefs. So when I see a police officer yelling at somebody, it's because they believe that's what they need to do, right? And so it's like, wow, we need to work on your beliefs. We need to work on your ignorance. And I mean that not in a derogatory way, but in the true sense of the word, what don't you know? You know? And so I see your leadership on this. I see you bringing what you know to this as an offering to Canada and Canadians to say, yes, Agnes Chen knows some stuff, but you'd be surprised how many people out there know stuff too on this issue that we haven't been able to have voice for yet.
Absolutely, absolutely. We did a survey, and it was just a survey through Google Docs, and we send it out into the interworld. And 160 people responded, and 50% of those were between the age of 14 to 24, so youth. And the stories they shared, and the experiences that they had, and we, I genuinely, some of the questions were, would you say having a parent with an addiction is stressful? What was your level of stress? How has your childhood stress impacted your stress today as an adult or, as a young adult? And within that, we offered options to, other and to elaborate. And the amount of people who this, you said it doesn't happen in the emergency, the lunchroom, but it happens out there. And 1 in 6 children, about 1 in 6 children are impacted by apparent substance use. And the stories that were in here were they were so descriptive, and they were so inspiring, because to hear, a 15-year-old or a 14-year-old share what they've experienced in a way with their truth attached to it, to say, this happened to me, it was not okay. This happened to me, and I still love my parents, but why wouldn't anybody help them? And then to sign and be anonymous speaks to the volume when we allow people to have a platform and have a voice, even if it's in an anonymous capacity. These voices and these stories exist, and stigma, right? I never would have thought that I'd be in a place where I am today to say with conviction, this is not okay. Because I just think back to even 10 years ago when I wanted to create an anonymous blog. But we have to provide a platform, and we have to listen to stories, especially when it comes from children and youth, because like you said, those hotlines, and I called one once, and it had no idea about my experience.
Yes.
Right? And so how do we create a space where people can share and reach out for help and genuinely get it? Yeah.
So, I'm deeply impacted by this conversation today. In a very good way. And I was thinking, one of the things we do here at CAPSA is we don't try to get people to become public. Stigma is real, right? We try to change stigma so people can become public. But there's a whole bunch of folks out there who need to be private still. Often some people said, well, how'd you get doing this? And I said, well, I was old, I was white, I had nothing, and I'd suffered a lot, so there wasn't anything the world could do to me that hadn't been done. So it's easy for me to advocate, right? But not everybody's in that position. And I think I hear in your story, if we can go back to that moment you didn't push the button. What was it like after that for you? How did you feel after not pushing the button?
Very angry and very sad, because I felt like I let my family down. I felt that I didn't have a voice to say that this isn't okay, and that was overridden. And I can relive that even in my parenting, right? And how many times I didn't, because I'm not good enough. Yeah. So definitely a lot of anger and frustration for sure, and sadness. Yeah.
Very real.
Very, very, very visceral. Very, very real. Yeah.
And I think about how many Canadians listening right now who know that truth, who know that moment of not pressing the button, of not picking up the phone, of not speaking up at the dinner table. And I think about how many Canadians we need to have that moment going forward to hear these conversations and to remember when they thought it was okay not to speak up. They weren't saddened by not speaking up. They felt safe by not speaking up. And I want them, and I think you want them, to get in touch with the sadness of that's not okay.
Absolutely. And that, I resonate with all of that, because for me, it's like, you know, I always say to the storytellers, like, keep telling your stories. And if you feel safe to tell your stories, tell it, and tell it in a way that is your truth, not to cater to anybody else's. But for listeners, for all of us as listeners of people's stories, we should never have the expectation that someone's going to bare the darkest corners of their soul. And that's the hard part with addictions and substance use, because it's often rooted in trauma. We hear addictions and we automatically have a label or what that looks like. And so you don't hear the stories that share what it genuinely looks and feels like. Because, you know, even for me, I've never had an addiction. I've never struggled with an addiction to drugs or alcohol. So I have no idea what that feels like, but I know what it feels like as a child. And on top of that, you know, I can see what that did and has done and is doing to my parents. But if I share certain stories, am I decreasing the stigma of addictions, or am I perpetuating what people already see? So for me, people always ask, you know, what is a situation that's happened before in your life? And I will never share those stories. Yeah. Right? And as listeners to people's stories, whether it's first responders who are in that moment, who are listening because we're in the presence of that crisis. You know, Dr. Gabor Mate, and I know we've chatted about him, he, at one time at a conference, he said, you know, what is your role? You know, it was to counselors, what is your role in that moment? And people gave different, you know, help them do this, help them do that. And he said, it's simply to be present. Simply to be present. And so when we have an expectation of what's going to happen, or we want to dig deeper because we want to get something more, that is really harmful.
It's incredibly harmful. One of the things I like to say, if I told you I was scared as a kid, does it really matter why? Are you going to go back there and change it for me? Right? Or can you relate to my fear because you've been afraid of something? Afraid you wouldn't get the job, afraid you wouldn't pass the college exam, maybe different sources of fear than the one I had. But we're trying to relate to each other and not separate from each other. Right?
Absolutely.
Yeah. If I said I love my dad even though there was difficulties, maybe for someone else they loved their dad even though he wouldn't let them have the car on Friday night. Different difficulty than the ones I had. But I know what it's like to love a parent when they don't approve of them. You know? So as we build these things together, right? Because I heard you, and I hear this loud and clear whenever I speak with Agnes, that there's love in that family. Didn't call paramedics because we hated their parents. Call paramedics because we loved them. Can they remember that when they get here?
Absolutely, and I think that's the part that I think gets missed a lot, is that, you know, we attach what somebody who struggles with their substance use might look like or behave like, and so that means automatically, because it's socially unacceptable or it's misunderstood because we don't understand how trauma might impact someone's behaviors in a moment, that the kid must hate their family, or they must hate and they want nothing to do with them, or they want to be as far away from them as possible. But it's just not true a lot of the time, and a lot of time it is, and there can be harm that's done, but we have to look at it from the perspective of the family and what they are needing in that moment and what they're wanting in that moment. You know, like as a youth, I even remember, you know, it's, you know, that statement, addictions is a family disease. And I remember as a teenager thinking, like, when I, you know, even as a teenager Googling, who can I get in touch with about this issue? Yeah. And always you would find, reach out for help, and addictions is a family disease. And I thought, oh, addictions is a family disease. That makes sense in my youth brain. And then as I got older, it really frustrated me. And, you know, today, you know, even statements like that, how does that perpetuate the stigma of substance use and addictions? And, you know, when we talk about bullying and that idea, when we have statements like that, what does that do to a child or youth who doesn't want to become that, who doesn't want to grow up in a certain way? And then on top of it, what are we offering families? If it is a disease, what are we offering children and youth?
Well, and I think pain is a contagion, right? Perhaps that's what really we mean. That pain's a contagion, and when people are in pain, that is a contagious thing that infects the family. But so is hope, right? So is health, so is love, right? So safety, those are contagions as well. And so it's what will we work on. And it's not from the family, right? It's from a family member who's in pain, right? I don't know. So, and yes, maybe other family members get engaged in that pain, but how they respond to that and how they're supporting that, which in my mind is the question. I want to say now, if I can, I'm a little excited. So by the time this podcast comes out, it'll be announced that every police officer, every police member in Ontario, including the Ontario Provincial Police, in the next 6 months will be required to take stigma training that CCSA and CAPSA helped develop.
Incredible.
And as I'm speaking to you, I know we missed a chapter. And so maybe next time we do a podcast together, Agnes will be talking about how we help public safety officers learn how to be better with the children.
Oh, that's incredible. You know, Gord, I think just even that influence to be able to empower police officers with that knowledge, it's something that, it's interesting. We know that stigma exists, but we sort of, that's the power of stigma, is we don't talk about it, right? Yeah, and even, you know, this is what I love about what you do, Gord, is and this is why it always resonates so much. You know, when I talked about, you know, myself at 5, seeing those first responders come, for me, it was, you know, that child self was saying, we're so good, we're so strong, why don't you see this? And as I kept growing up, that was the message for me, because, and I know as a nurse, the patients that I have who struggle with homelessness, with addictions, you know, with really challenging circumstances, they are probably the most resilient and hopeful people ever, because why would you want to wake up again the next day and try to face it again? Right? And they do, and families do, and children do. And, you know, when we talk about resilience, right, defined as bouncing back after adversity. And for me, when I look at it from the lens of like a first responder and how we can empower them, police officers, health professionals, we know, as you said, it's what support does that family have? And if resilience is bouncing back after adversity, how are we going to support families in that adverse moment to be able to move forward, to be able to get out of it? What are we going to offer them and provide for them in that moment, right? We come in crisis as a health professional. We're in that super vulnerable part of a human's life in a moment in time where they are struggling. We have such a beautiful opportunity to provide them with hope, to offer them something that says, there is hope. You are safe with us. You're going to be okay.
Well, you know, there's not a lot of value in saying this isn't right. And it's like, well, why do you think we called? Yeah, we get that. Okay. Thanks for coming out. Thanks for coming out. Didn't need to be blamed.
Why are your parents drinking on a Wednesday?
Yes, a good question. Okay, not very helpful. Okay.
Yeah.
Yes, right. I'll do something about that.
Yes, I will.
Yes, okay.
And that poses, that's the big picture, is that stigma means families have to work it out and figure it out. Right?
Well, and all of a sudden you have children trying to control adult behaviors, right? And taking responsibility for lack of control. I don't know. I don't want to talk too much, but you know, that idea that we're powerful, right? That the 6-year-olds make the parents unhappy, the 6-year-olds make the parents happy. This concept that we are controlling their emotions, and therefore, if parent is unhappy, parent is angry, I have done something wrong. My plan has failed. It's not that I can't control them. It's my plan failed. I need a better plan. And then that obsessive thinking around controlling others, and of course it's a form of madness, and that the 6-year-old doesn't recognize, but the 6-year-old goes up to a 15-year-old and hasn't changed their strategy yet, just getting better plans.
Absolutely. And you know, for me, like, Starlings are, you know, and I do call it, you know, a harm reduction model, because for me it is, how do we reduce harm to families? How do we invite that conversation of, how can we give you more information so that you can see yourself in a way that is hopeful and beautiful, not thinking you're going to go down this same path, because a lot of people and children think that because it's my fault, this is happening. But that's been validated to me by my parents, that's been validated to me by first responders, that's been validated to me by policies and practices, because there's nowhere I can actually reach out to for support. So because there's no support, that must mean this doesn't matter and I'm asking for too much.
Yes.
So how do we, as organizations, as advocates, and then as policymakers, how do we make sure we tell people and families, and especially children and youth who are so moldable, how do we tell them and empower them to know that they have value and they exist and it is not their fault? And it's not by sharing messages, it's not your fault.
Yes.
Because unless we show children and youth that it's not their fault, those messages just don't matter, unfortunately.
And we're talking about a whole bunch of people who don't have frontal cortex.
Absolutely,
Right?
yeah.
And so they're very factual oriented. I saw this, so therefore it's true. I'm not contemplating what I saw. I'm not considering the possibility that I misinterpreted. That's going right to the primal brain in terms of survival. And of course, then you have children trying to survive instead of thrive.
And when you've been in survival mode your whole life, unfortunately, we don't just get out of it once we turn 18 and we're considered an adult. Which unfortunately, society believes we do.
Yeah, you're responsible now. Yes, for the whole world's happiness.
And that's a lot of pressure on people who have not been given any support. And yes. I know maybe that this takes away the human aspect of it, but when we look at stigma, and last year, the Adverse Childhood Experiences study, which was foundational in a lot of what's happening today, in understanding how stress impacts the developing brain and impacts mental illness, addiction, physical illness. This year, actually, 2021, July, there was a Pan-Canada study released, ACEs survey, thousands of individuals. I was excited not because I think that the ACEs study is the end all be all. I think it provided a very good lens for how stress impacts the developing brain. But this study, so the original ACEs had 10 that they focused on, right? Parental addiction was included in that, witnessing domestic violence, having a parent who's been incarcerated, parent with a mental illness, abuse, neglect.
Yep.
From the original 10, in the Canada version that was just released, they omitted parental substance use. So in the original study, it was one of the top 2. In subsequent studies around the world, it's been replicated. It's always been within the top 3. In Alberta, it was the first one, I believe, when they did it. And I emailed one of the researchers, and she was very gracious. And so this is nothing, to them as people. But when we're talking about stigma, and I asked how come it was omitted, because one, for me as an organization, it's a very great lens to see how many people are impacted in Canada, because we don't have that literature. I think 2013 Stats Canada has it as about 1 in 6. And they said we have no good answer, simply that we did not think it would be one of the top 10.
So there's a level of innocence and also a measure of the silence of stigma. To even think there's people in the world who wouldn't know that. And that's the silence of stigma. Having people believe. Why is there a lot of that?
And and I think that when we look at that, trickle down effect, if we can include that, it's how do we create policies? It's when we believe something matters. Yes. We believe certain people matter, and so we want to create change and transformation and improve their life, right? And these sort of huge studies, and it was thousands of individuals, would have given a very big perspective of how prevalent this is. And not to say there's this many people who are addicted, but to say this is how many people are being silenced and left behind, and we are offering them nothing.
Well, and what I do see, though, I see very clearly the absence. Sometimes it's the silence that speaks loudest. The absence of this. I'm already writing the article in my head. We'll talk about that afterwards, but there is something to be said for that speaks really well. We're going to do a substance use health survey this summer in Canada. more about that later. I'm just going to look at the clock for a second. So I think we could talk all day. I'm really glad you're in town for a couple of days. So you and I are going to do that and make a video and some other things. We're meeting with Health Canada and with Canadian Centre on Substance Use and Addiction, working on ways to work together. I know we're going to talk together with public safety about that next piece as an add-in. I guess what I'm winding down to say is that I'm so grateful, myself, CAPSA as an organization. I think Canadians owe you a certain sense of thankfulness for your courageous work. And I say courageous because there was a time when you didn't press the button, right? So that's a true story, right? And so there's no requirement for courage without fear, right?
Oh, absolutely.
Right? And so both are there. So I'm sorry for your fearfulness and I'm grateful for your courageousness. And I'm looking forward to the changes that you're going to bring into this world and other like-minded individuals who you're building a platform for. And I'm really pleased to be part of that. Go podcast, go Agnes Chen, go Starlings.
Thank you. Thank you for everything you're doing. And as you know, it is co-creating this, just that safe space for people to say, like, they can see themselves in something bigger than their current circumstances. And that is a really powerful and beautiful thing. So thank you for providing this platform.
All the best.